Welcome to Series 3, where we'll be covering families who are currently pregnant and affected with genetic kidney disease. So, Carolyn, for those couples who are currently pregnant and have concerns that their baby might be affected by genetic kidney disease, what are these couples' current family planning options?
Yeah, so there's a few options that would be available to you if you're already pregnant. So, you can actually test a pregnancy that you've already got underway. And so the first option would be to test at around 12 weeks in the pregnancy through a test called CVS, which stands for chorionic villus sampling. The chorion is just another name for the placenta. So it's testing a small sample from the placenta. So that's option one. Option two is testing at around 16 weeks in the pregnancy through a test called amniocentesis, which takes a small sample of the fluid that's in the baby's sac. And this fluid contains skin cells that the baby has shed that contains the baby's genetic makeup. So both of these tests can provide you with as close to 100% accurate answer regarding whether your baby has the condition or not. Now, these are both what we call invasive tests because they're actually sort of, tampering with the environment of the baby to get those cells to test. And so in doing so, they can sometimes, in a small percentage of people, result in a miscarriage. The risk is low. It's about a 1% chance of having a miscarriage from having a CVS at around the 12-week mark, and about a 0.5% chance for miscarriage associated with an amniocentesis. So, some people choose to have these tests because they actually really want to know, because they have a plan to stop the pregnancy if the baby is affected. And that's a valid option, and we would support that. Other people choose to have one of these tests to prepare for the possibility of having a baby that's affected, so that they can prepare themselves and they can prepare their doctors, their kidney doctors and the obstetricians. And when we do these tests, we can actually add on additional tests at the same time, such as testing for Down syndrome. Now, there's different kinds of options available for stopping the pregnancy if that's the choice you make. And the method differs depending on which stage of pregnancy you're at. So we would advise speaking to a genetic counsellor to understand in more detail what those considerations and options are. The other point to make, I guess, regarding options in pregnancy is that sometimes close monitoring of the baby on ultrasound is a reasonable option, because there may be some clues or some findings that can present themselves on ultrasound, which might then inform whether extra tests such as CVS or amnio could be provided.
So Carolyn, if couples were really hesitant for any of the tests and just were keen to proceed with the pregnancy, is that a choice available to them?
Absolutely. I mean, it's always your choice. And, your genetic counsellors and doctors are here to support your choice. And there really is no right or wrong. So we're here to provide you with the information and support you in the best decision for you. And this is why we often recommend, speaking to an expert who can help you make those decisions.
So for these couples and families, where should they go and who should they speak with to help navigate these difficult decisions?
Yeah, it can be a difficult, overwhelming time. So we would recommend that you obtain as much support as possible. And, there should be a local genetic counsellor available to you wherever you live, who can help you, weigh up all those options and help you make that best decision for yourself. Your kidney doctor can also help, and they may wish to also refer you to a genetic counsellor for additional support to explore options in more detail. And you may also find that speaking to Other people who've been through the same experience might be additional support for you as well.
And with your experience helping many couples navigate these difficult decisions, any key concerns that are expressed by families in this situation?
Yeah, look, I think, you know, the first thing to say would be it's really quite normal to feel worried and anxious and concerned about the possibility of a baby being affected. So, you know, these feelings of uncertainty and of anxiety are quite normal. We hear this a lot. And, you know, some families feel a bit conflicted about whether to have an invasive test in pregnancy. You know, they know that on the one hand, they kind of want to know if their baby is going to be affected, but on the other hand, you know, they're concerned about potentially causing a miscarriage to often a very much wanted precious pregnancy. So it can be a very difficult decision to make, because these tests, as I said, can result in miscarriage, and that can be quite worrying. And also, some people don't really know ahead of time, you know, what they will do with the information they receive from these tests. So some people know in a very clear-cut way that they would either stop a pregnancy or they're just doing it to prepare themselves. But others are much more conflicted by that and kind of can't make that decision until they get the information. So, you know, really, in other words, it can be a very emotionally, you know, challenging time. And, you know, weighing up the pros and the cons of the tests and looking at all the risks and benefits can really feel quite overwhelming at times, particularly if you're dealing with your own condition as well. And so we know that, you know, thinking about all these options and, you know, making all these decisions can, you know, take away from the sort of very natural sort of happy feelings that are associated with pregnancy and with family planning. And so, again, this is where extra support from a genetic counsellor, you know, might be important during this time. And you know, we'd, you know, point out that it's also, I think, really important that you have, if you've got a kidney condition yourself, that you speak with your own kidney doctor about, you know, managing your own health during the pregnancy, because first and foremost, you know, we need you to make sure that you're as well as possible and that your kidney condition is being looked after.
And lastly, Carolyn, what options are there to families and where would you direct families once the baby is born with concerns for genetic kidney disease?
Yeah, so look, you know, I keep mentioning genetic counsellors, but you know, really, if you haven't had testing prior or there's been uncertainty along the way, then I think, you know, speaking with your kidney doctor and or genetic counsellor can help you, again, make a decision as to whether you feel you want to test the baby if you've had no testing prior and you're unsure about whether you need to test after it's born. Again, we can help with that decision making, and there's no right or wrong again. And sometimes just understanding the information early on can help you work out when is the right time to test, if at all.
Wonderful, Carolyn. Thank you very much. So this terminates our series on family planning and genetic kidney disease. Thank you for watching.